If you look at the history of families and health insurance coverage, we're used to the fact in the United States that if you work at a good job, you get health insurance coverage. Well, for dependent coverage, that was not necessarily the case. Medicaid, which of course was the big program, covered some poor children, but not all of them. It only covered children and families that received cash welfare benefits in the early days. And so the major odyssey, really, that CDF went on, and that I was fortunate enough to be part of when I was there, was the effort to get all poor children covered under Medicaid. And that was really chapter one. And with those changes came not only their coverage, but a tremendous improvement in the quality of the coverage through a special benefit known as EPSDT, one of CDF's first books. EPSDT doesn't spell healthcare for poor children. It's a classic in the field. And so CDF sort of worked on both fronts. The second great wave was the enactment of the Children's Health Insurance Program, which was designed to be sort of a bridge between Medicaid for the poorest children and employer-sponsored coverage. And of course, the third major wave is now what we are going through as a country, which is an attempt to consolidate all of these reforms into one coherent national health insurance system. And children now, of course, are scattered across really four possible pathways to coverage. They're in employer coverage, although, increasingly they're not. It's now, I think, less than half of all children have access to employer-sponsored benefits. Children are, the biggest group is in Medicaid because children are so poor, as I'm sure your other chapter authors will delve into. About 9 million are in CHIP. And then there are some coming into the new subsidy system that involves tax credits for plans sold in the health insurance marketplace. What we have now is sort of children on these four different roads to coverage, but virtually all except for children who were not born in the U.S. And are not legally present in the U.S. Those children, like their parents, if they are not legally present in the U.S., remain excluded from everything. To think about doing for children what we did for the elderly, which is to create a single unified coverage arrangement that all children derive basic coverage through, just like with Medicare beneficiaries, you can always buy supplemental coverage if you want some supplemental coverage. But the notion that working families shouldn't have to be concerned that they work for an employer who doesn't offer affordable family coverage, and their incomes change over time, and therefore their children get bounced from system to system in this new arrangement we have. Because, of course, Medicaid stops at 138% of poverty, and CHIP stops at wherever the state sets its CHIP limit, and then, the premium subsidies stop at a different level. And at each of those stop points, you have what experts call churn, sort of across the dividing line, where families may find that their children's coverage is interrupted, their treatment is interrupted because health plans have different providers in their networks. It's very confusing, and I think we can make things much simpler for families and much more straightforward for families if we say, at the time your child is born, your child is enrolled in whatever we would call it, the children's version of Medicare, good comprehensive coverage. You can always buy some supplemental coverage for things that Medicare for children wouldn't cover, but you don't have to then think about it again until your child enters the world of work and graduate school or whatever the child is going to do, out of college, out of school, and into the work life, and then would enroll in the adult system.